Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you so much for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce MAP's Divisional Director, Ray Walker. Ray, over to you.
Good morning, everybody. Thank you guys for joining us. Rachel, thanks for introducing us. Folks, I am so excited about what we're going to cover today. This is a program that's been around for a very long time and hardly anybody knows about this, but it is so critical. I can't tell you the number of people that just on the spot I have had to talk about this particular program because it came up at the moment that they needed it. And if more people knew about this, they would be able to help others with it. So today we've got the expert on this program. Joining us today is Nancy Jobe. Nancy has accumulated over 40 years of marketing and public relations experience across a variety of industries. She's been an outreach specialist for 10 years with Acentra Health, the beneficiary and family-centered care quality improvement organization. In her current role, she partners with stakeholders, provides outreach to providers, and engages Medicare beneficiaries to raise awareness about their Medicare rights. Nancy enjoys helping beneficiaries understand the magical world of Medicare. Nancy, thank you so much for being here today, and I really look forward to hearing what you have to say and for people to understand more about the program that you represent.
Thank you so much, Ray. I really do appreciate being able to talk about the services that Acentra Health does for the Medicare beneficiaries there in the state of Oklahoma. To explain a little bit about Acentra Health, we used to be called KeyPro. So if you've heard of that company, KeyPro, we are now Acentra Health as of last year. And we are the Beneficiary and Family-Centered Care Quality Improvement Organization. I know that's a big one, so we'll just say we're the BFCC. And we're going to talk today about our services that we provide and explain to you some of your rights as a beneficiary and what you can do in certain circumstances. So some of the things we're going to talk about today is about hospital discharge appeals. So we'll get into that, and we'll get into skilled service termination appeals. And when I say skilled service, I'm talking about if someone's in a skilled nursing facility, receiving hospice, home health, outpatient rehab, those kind of services is a skilled service. And I'll talk also about immediate advocacy, beneficiary complaints, and observation appeals. So all of our services are free to any body that's on Medicare, whether they have a Medicare Advantage plan or Medicare as a secondary insurance. So anything that we're talking about today, and there is one piece that is not, we do not do for people on Medicare Advantage, and I will explain that when we get there. Okay, so with the hospital discharge appeals, well, a lot of people do not realize that when they're in the hospital and then the doctor comes in and says, hey, you're going to get discharged today, but you as a patient, you don't feel like you're really ready to go home, or maybe you're a caregiver for someone and you're like, I don't think they're ready to go home. And you do have a right to appeal that decision, and you do that by When you receive notice that you're going to be discharged, somebody should give you an actual piece of paper that says an important message from Medicare at the very top of it. And in that piece of paper, it explains to you that you have a right to appeal it, and it gives you our contact information. Acentra Health, it'll say Acentra Health on there, and have our contact information, a number to call. And you will need to give us a call by midnight the day of discharge. So say the doctor comes in there at 3 o'clock in the afternoon and says, we're going to discharge you, and you're not feeling like you're ready to go home. You have a right until midnight of that day to start a discharge appeal. You don't have to go home. They'll come in and say, we're getting you ready. You don't have to go home if you're going to be filing an appeal. You just hold your ground and start your appeal process by giving us a call. Now, if you give us a call after our, like say 7 o'clock at night, a family member comes in and see that you're really not ready to go home, and then you don't start your appeal process till 7 o'clock at night. Our call lines might be closed at that time, but you just leave a voicemail. You don't have to leave because you started your discharge appeal. You just let the hospital know that you have filed an appeal. So in the first thing in the morning, what's going to happen after that is they will start the appeal process. That doesn't. Now, the same, and we're going to go through that process here in just a second. The same process goes for a skilled service termination. So let's say you're in a skilled nursing facility and you're getting discharged and you just really don't feel like you're ready to go home. And you haven't used up all your Medicare days, so you still have time that you could stay in that skilled nursing facility. You have a right to appeal that. Now, it's going to be a little bit different with say, skilled nursing or hospice or home health. They're going to give you a notice of Medicare non-coverage, or somebody might call it a NOMNIC, and you think, what is that? Well, now you know what that is. A NOMNIC is a notice of Medicare non-coverage. And with that, you're going to receive that 48 hours, so 2 days before that services are going to be terminated for you. So you have time to kind of plan that, but maybe you just feel like, oh, you're not ready to go home even in 2 days, but you have a right to appeal that process. So you start that process with us, and you start that by noon the day before the services are ending. So that gives us time to get an answer before the services are really end. So an example of an appeal would be Benjamin, in this case, was admitted to the hospital. He'd been there several days, and when his doctors told him that he was going to be discharged in a couple of days, his wife was worried that she wouldn't be able to take care of him. You know, sometimes it's not the patient. The patient's ready to get out of that hospital, but the caregiver is really uncertain that they can take care of him properly. So she might start a discharge appeal on that process. So what's going to happen is she's going to receive that notice, whether it be the important message for Medicare, or say they're in a skilled nursing facility, that notice of Medicare non-coverage. And then once they receive that, you have to contact Acentra Health to start the appeal process. And what we're going to do on our end is we're going to contact the facility or the hospital, and we're going to gather up the medical records on you. And one of our physicians will review that. Now, we use physicians locally, so I mean, our office may be in Tampa or Pennsylvania, one of our offices, but we're going to use an Oklahoma physician to review that. And what they're going to do is they're going to decide whether or not, yes, you should be discharged, or no, you should be able to stay. And so once they do that, then they're going to contact you and the provider of the decision that is made. Now, one thing to remember is, let's just say that they come back to you and say, yes, you should be discharged. You do have a right to appeal that, to have another look at your process there. So once what you have to remember is while we're doing that first appeal, the hospital's paying for everything. You're not paying for anything while you're having to stay that extra day for us to determine whether or not you should be discharged or not. But should you start an appeal on our decision, so you want a reconsideration, it's possible that you will have to pay for the stay from that point to making a second reconsideration if we do not go in your favor. If we go in your favor, of course, you wouldn't have to pay for anything. But okay, so let me break this down for you. You've come to us and you've filed an appeal. You said to us, you're not ready to go home. We start the appeal process. We come back to you and we say, yes, you should be able to go home. And sometimes, people, you just need that one day overnight to kind of figure out, okay, I'm ready to go home now. Sometimes it's a shock when the doctor comes in at 4 in the afternoon and says, you're going home, and you don't realize you're going home. So, but just if we do come back to you and say, okay, you should go home, but you still are not feeling well, you don't want to go home, you don't think you're ready to go home, you have a right to appeal that. And once you start that second appeal, it's a possibility you're going to have to start paying for the bill if we don't go in your favor from the point of our first appeal. So you have to be sure that you understand that there could be some financial obligation on your part if you reconsider. One of the things is when you start the appeal process, a new program that started last year was somebody is going to contact you, unless you're on Medicare Advantage. This does not affect, if you're on Medicare Advantage, this is something that we don't do, but if you're on regular Medicare, this is something that we do, is once you start the appeal process, they're going to, somebody from Acentra Health is going to contact you, and they're going to make sure all your discharge planning is in place so that you feel comfortable going home. Understand what you're going to have to do, what isn't. Make sure you have everything in place. If you need DME equipment, medical equipment, then they're going to make sure that's there for you when you get discharged. And they're going to make sure that you feel comfortable going home. And sometimes just that process is the reason why you want to appeal. So if we've got the discharge appeal set up for you and everything is in place, a lot of people will just go ahead and drop their appeal because they know, okay, I'm ready for this. So that is something that started last year, and that you will be contacted by somebody from Acentra Health to make sure that you understand everything you need to do for yourself for a speedy recovery once you go home. So the main thing is for appeals is that you start your appeal process in a timely manner. If you're discharged from the hospital, you have to do it by midnight the day of the discharge. And if you're being discharged from a service like home health, hospice, skilled nursing, you have to contact us by noon the day before your termination of services. Now, another piece that just started this year is a hospital observation appeal. And a lot of people have put on observation and then and not put in the hospital, but that's not what this is about. This is about you're admitted to the hospital, and all of a sudden the hospital decides they're going to put you on observation. So you're admitted to the hospital, and this is done within the first day or so. And then you get a notice that you're going to get a Medicare change of status notice that's going to say, we're moving you to observation. And the reason why they do that is because it's a different pay scale, whether you're admitted to the hospital or admitted on observation, because it's paid out of a different fund for that. And so sometimes the hospitals will go, if they know that you're just in there and the criteria is that you really don't meet admission criteria, but we can keep you in the hospital just to observe what's going on. So therefore they will move you to an observation position, and they are going to let you know you have a right to appeal that if you feel like you really need to be admitted to the hospital. So you would start that appeal, and that just started in February of this year. So this is something new that a lot of hospitals are doing, is they have you admitted and then they move you down to observation status. So you do have a right to appeal that as well. So pay attention to all those little pieces of paper that you get when you're in the hospital. So you could get, when you get in discharge, you could get that important message for Medicare. It's an important piece of paper. If you're in the hospital and they hand you a Medicare change of status notice, then you need to look at that, because that's saying they're putting you on observation. And that's okay to be an observation. It's just a matter of, it's just a different type of payment for the hospital, because you didn't really meet the criteria to be admitted to the hospital. So if you have questions about that, any of the discharge appeals or home health or hospice or skilled nursing, if you put that in the chat box, we'll talk about that at the end. Now, this is another piece service that we do with Acentra Health is immediate advocacy. And this is a piece that you can use anytime that you need us to help you resolve medical issues that you may be encountering. It's something that we try to do very quickly. It's something that, for instance, let's just say you're at home and you're trying to get your medicine refilled and you're out of refills and you can't get it refilled and you're having trouble with that. And they say, well, you got to go to the doctor. You call the doctor's office and they're saying, well, you've got to come in and you still need your medicine before you can actually get in, and that whole circle that you have to go through. If you contact us, we're going to attempt to try and figure out how to fix that so you can at least get your medicine before your appointment. And it might be that we're going to call with your permission, give a call to the doctor's office and see if you can get the refills until at least get you covered until you are actually being able to see. It could be something as simple as you're getting home health services and you're not getting they're not coming on a timely manner and you're concerned about that. You've called the home health agency. They don't seem to care. So you can give us a call. We're going to intervene and try and figure out how we can get the best service for you. It's all about making your recovery and making your medical issues get resolved. So it could be a lot of different pieces of your medical health that you're needing help with. Maybe you're just trying to get an appointment, you can't get an appointment, or you don't know who, then we're going to refer you to services that are going to help you with that as well. So it's our immediate advocacy is really an important piece that can help you on a regular basis, whether you've been in the hospital or not been in the hospital. This is just something that we'll take care of for you. In this example, it was a lady that was getting a home health, and the home health therapist would come in and she'd be there 5 minutes. Well, the beneficiary was feeling like she wasn't getting her full workout that she needed, her therapy that she needed. So she contacted Acentra Health. When what we did is we got with her permission and we contacted the home health agency, and we actually did a three-way call. We do that a lot. We want you to be a part of the what's going on and to explain what's happening. So we did a three-way call and we got the beneficiary talking with the home health agency and trying to figure out, well, how do we make this happen so that that you get the best result for your home health therapy. And with that discussion, resolution was made that resolved it by they actually assigned it different. In this particular case, they actually assigned a different therapist to come in to work with that beneficiary, and she was able to get her 30 minutes of therapy every day instead of 5 minutes. So the immediate advocacy process can be very helpful for you. And if you have a question about that immediate advocacy, please put it in the chat box and we'll talk about it. Now, a quality of care complaint kind of sounds like an immediate advocacy issue, but it's not. It's a totally different service that we do. A quality of care complaint, it could be something that happened to you within the last 3 years, not something that's just immediate. It could be something that you went in for some kind of a test and you went in for a chest x-ray and all of a sudden they're doing x-rays of your hips and you're thinking, oh, what in the world? So, I mean, that's definitely a quality of care in that they're x-raying the wrong part of your body. So that is something that we don't want to see happen to somebody else. I mean, it's already happened to you. That's true. And that can't be changed. But we don't want things to happen to other people. So we encourage you to file a quality of care complaint so that we can look into what's going on so that doesn't happen to somebody else. Now, I will say that if you're trying to file a lawsuit about something that happened to you, any findings we have cannot be used in a lawsuit for that at all. So what happens with you when you file that beneficiary complaint? It's kind of a little bit more of a formal process in that you file out, you contact us and we fill out a form. Nurse is going to talk to you and find out if it's really truly something that is a quality of care. Maybe it's an immediate advocacy thing that we can take care of, but they're going to find out if it's a quality of care complaint. And they're going to prepare all the documents, gather all the information from the provider, and give that to a physician reviewer. And what's going to happen with the physician, they're going to determine whether or not the care met professionally recognized standards. So that's really an important piece there that they're going to determine. And if they determine it does not meet that, we are going to probably put that particular provider on a quality of care complaint. And, that might be that they re-educate them or they follow them for a while to see if it's a pattern that they have. But whatever it is, they're going to make sure that it doesn't happen to somebody else. And that was the whole intent of filing the quality of care complaint, is to make sure it doesn't happen to somebody else. We want everybody to have good quality care. We're going to let you know what happened with that. And of course, if we find that it did meet recognized standards of care and you feel pretty strongly about it, you still have a right to have a reconsideration on that as well. In this particular example for a quality of care, the Medicare beneficiary was in a skilled nursing facility, and she was supposed to receive medication on an hour before she was eating, but she didn't ever get her medicine, and lots of times she never got it at all, but it would be late. So the family was concerned about that quality of care, and they contacted Acentra Health to find out, to have them kind of investigate it and find out if that's a pattern with that particular skilled nursing facility, how can that be remedied so it doesn't happen to somebody else, and more importantly, make sure it doesn't happen to their loved one anymore as well. So if you have questions about that quality of care, please put it in the chat box and we'll answer that. Now, our helpline hours are 8 to 5, and on the weekends, 10 to 4 there in Oklahoma. If you called outside of those helpline hours, go straight to a voicemail. We're going to answer it the first thing in the morning, and we do have translation services available. I am trying. And for your area, the toll-free number is 888-315-0636. And we can have Ray get that number out to the attendees so that you have that should you need it. Or you can always call the SHIP program and they will have that number for you as well. So today we talked about hospital discharge appeals. We talked about skilled service termination appeals. That's the home health, hospice, skilled nursing, and beneficiary complaints, that quality of care complaints, and immediate advocacy, and the immediate advocacy when you're being discharged from the hospital, and observation appeals. So we talked about a lot of different things, and you can find out a lot of things on our website at acentraqio.com. We have all kinds of podcasts that we have, and in fact, I just recorded a podcast with the Oklahoma Hospital Association this week, and it will be airing in May, so you can find out what your hospital association is doing there in Oklahoma and what they do for you. But we have several different podcasts that you can learn about, and different resources that you can find at acentraqio.com. There's the phone number that will be called. You there in Region 6, the 888-315-0636. And I do apologize for that internet connection. I apologize for that. I never had that happen before. That was kind of shocking to me as well. So I will open up the floor for any questions that might have come in, Ray.
Thank you so much, Nancy. And I wish I could say that had never happened to me, but unfortunately I can't. I do have some questions, and mine are very specific to the hospital discharge appeals. I can't tell you the number of people who that has come into play with over the years that I've been doing that job. And it's been invaluable to those people. First question. You talked about the patient or the patient representative. Who determines who can be a patient representative?
Well, basically on that front, we let I just have you call the helpline because they're going to I mean, if the patient is not able to make that decision and it's a family member that's there, or
Hmm.
maybe they don't have a family member, but there is somebody there that just can speak on their behalf, they're going to at least get that ball rolling for them. It really
Okay.
is not a designated legal person.
Okay. Great. Next question along the same lines is you talked about how the hospital representative will come in and inform the patient that they will be discharged the next day. In a situation where possibly the patient isn't the best person to inform of that decision, if it should have been told to a family representative, uh, what is the what's the process in that case? Because we have had a situation where someone from the hospital came in and told, in this situation, it was someone's aunt that she was going to be discharged. The family was not made aware of it, and they didn't know that that was the hospital's plan, and quite by accident found out that that was where it was headed, and they were scrambling. So, in a situation like that, is there any latitude or extra time that might be given to the family to make plans or to file an appeal?
Actually, if once the patient has left the hospital, then there's nothing that can be done at that point.
They were
But if they're
still in
still
the
in there
hospital, but like as you said,
past the
they've got a
midnight
time
mark,
frame.
yeah, past the midnight. I mean, it's not a steadfast rule. So, I mean, to still go ahead and call. I would also suggest that usually they will contact the person that is listed as their emergency contact. I mean, that's what the hospital should have done. I know when my mother was in the hospital, they called me because I'm her contact. So, I mean, in this particular case, I would have made sure that, if, I'm sure whoever helped admit the aunt should have
Mhm.
at least had an alternative emergency contact there and made that clear to the hospital. But I know we don't think about those things till after the fact.
Yeah,
So,
yeah.
um, but that is an important piece that if you're going to be put in the hospital, please make sure that the hospital knows who to contact um, in case of an emergency, or maybe you say you want them to contact no matter what. I mean, my mother doesn't even, when she's admitted to the hospital, doesn't use her phone number. She uses my phone number. So it's always somebody's going to be contacting me. So
Oh, that's a great idea. That's a very good idea. Well, Nancy, thank you so much for joining us today. I can't tell you how
Ray, we
much.
do have a couple more questions.
Oh, please go ahead.
Absolutely. So just two more. I think we've got time really quickly. The first question I can actually answer. It's is there a way to get a copy of the presentation from today? And so this is a great reminder to everyone to just visit MAP's webpage, which is map.oid.ok.gov. And all of our Medicare Monday webinar recordings can be found under that educational videos tab. So feel free to go take a look at that. Today's recording should be up sometime this afternoon. And then the next question, which is for Nancy, they want to know, how are Acentra Health services paid for?
we are a Medicare contractor, so we're paid through the Medicare Trust Fund. So we're definitely we are paid through the government fund. So yep.
Great question.
Thanks, Nancy. And those are all the questions that we had in the chat, Ray.
Thank you very much. People, I can't tell you how important that this service is and how many people that I know of that this has helped. The other thing that I think is very interesting about this is probably, I would say, two-thirds of the people that I have offered this information to have not been while I was working in my professional capacity. It's been while I've been in a public setting, just as a private citizen, and I've overheard a conversation, or there's been something that's come up that I've talked about this with someone. People don't know about this service, and it's so critical. So I encourage you, uh, you know, tell people, make people aware of this service. If you're a professional in this industry, it's our job. Make sure that people know that they have rights and they have the ability to learn this stuff. I did have one other question and I apologize. I know we're over time. Nancy, would you just please clarify when you're talking about the skilled services appeals, would you list again the different things that fall under that? It's not just skilled nursing facilities, but what else would fall under that?
You have home health, hospice, outpatient rehabs, anything that is considered a skilled service, like somebody's getting therapy or um, some type of therapy, whether it be occupational, physical therapy, um, or any kind of a skilled service like nursing care at home, that kind of
Okay.
thing.
All right. Okay. Thank you. Thank you. Thank you, Nancy. I'm so glad that we finally had an opportunity to get you with us today. And probably we'll ask you to do this again next year. So be prepared. For everyone that joined us, thank you again for being with us. We hope you will join us again next month for our next Medicare Monday, and hope you guys go out and enjoy the good weather before our next deluge of rain. So everybody have a great day.